Good evening, and thank you for joining us for tonight's Facebook, what was to be live, but unfortunately we were having technical difficulties that we're still not sure. Sue and I are pretty convinced what this is abject COVID fatigue. I know we're both feeling it. I think the camera is too, but what we wanted to do is at least just record this brief kind of update as to where things are. This, of course, is Monday, October 19th, and so we'll give you the information as to where we are right now. And unfortunately, we won't be able to answer your questions, but we'll plan on doing this again probably in a week, and we'll try and do it at that time. So, of course, as always, Sue Powers, Public Health Manager and Health Officer, thank you so much for being here.
Thank you.
Do you want to just go ahead and give us the sort of the state of the county as far as COVID's concerned?
Sure, I can do that. So I'll just start out with the state of Wisconsin is still setting records for high daily positive case counts. A few days back, the record was 3,800. Today was 3,777, so we're still really up there. And most of the state is in the very high COVID activity range as determined by the state metrics, and that includes Door County. So we've been at the very high level for over a month here in Door County. Today's cumulative total case count for Door County is 623. The last time we did a Facebook Live was October 8th, and that day we were at 493. So we've come up 130 cases in 11 days. Of those cases, the 623 for today, 68 are active. And I just wanted to comment that in the last week or two, we've talked to more folks that are having symptoms last longer than the usual 10 days, so they're not out of isolation in 10 days. We're still at the 4 deaths and 27 total ever hospitalized. So all the numbers I gave are for Door County residents. In other words, for the hospitalized total, they may have or may not have been hospitalized at Door County Medical Center, but they are Door County residents. What are we seeing? Same as the last couple of weeks. Gatherings of any kind outside our household units are causing spread, and that can mean just a few friends getting together, maybe extended family gatherings, weddings. There's been workplace spread. Household spread is sort of a given at this point. And there have been cases that have involved the K-12 schools here. The other thing I was just going to mention is we had our first Wisconsin National Guard testing event in the series that's going to be every week from now through December 7th, every Monday. So today's event was in Sister Bay, and it's going to alternate between Sister Bay Fire Department and Sturgeon Bay Fire Department. And today in Sister Bay, they did roughly 100 tests, and it went well. So if you're interested in that, next week it'll be in Sturgeon Bay, and in 2 weeks again in Sister Bay. That's my update.
Okay. So I wanted to also give an update as far as the hospital is concerned, because I know there's always a lot of interest as to, what is our capacity and things like that. So similar to what Sue was talking about, we currently have 5 inpatients that have COVID-19. Our maximum at one time was 8, which was toward the mid part of last week. All of those, the patients that have come and gone, we've had, as Sue mentioned, no further deaths. People that have been discharged have discharged and did well, went home. I think the current 5 that are in-house are the different 5 from those 8 that we had last week. So we certainly have seen an uptick in the number of hospitalizations. And thankfully, though, they're not anywhere near as critically ill as the ones that unfortunately died early on in this pandemic. But they certainly are requiring hospitalization, supplemental oxygen, things like that. One of the questions that was asked last week, and I thought it was sort of made for an interesting piece, is people were saying, well, do these patients get the same thing that the president got? And what the president got was remdesivir, which is an antiviral. He got dexamethasone, which is a steroid. He got, I don't think he got convalescent plasma. I don't remember if he did, which is, again, that it's a blood transfusion of plasma. that has antibodies from those that have had COVID. He also got what's called a polyclonal antibody. The brand name is Regeneron. He got that. That's still an experimental treatment that's not widely available. It's available usually in larger medical centers for compassionate use only. So we here at Door County are doing the exact same thing other than the Regeneron. People are generally getting remdesivir, dexamethasone if their oxygen level is low enough, and they're getting convalescent plasma. So we are doing pretty much the same thing. There's not a lot of other new treatments that are out there at this point. Now, the other thing that people want to know a lot about is how is the hospital? Do we have enough room? Things like that. The answer is absolutely we do. We have had the most people in the hospital that we've had in the 10 years I've been here. Last week we had 31 patients in our 25-bed hospital, which is a testament to how we actually are able to repurpose some areas in order to house patients. And so I want to do the best job that I can to let you know as community members, I don't have concern for my family, for yours, that if we need to take care of you, we can do that. Hospitals in Green Bay have been quite full. So that's a part of that equation as well. But if a person needs more advanced care than we are able to provide here, specialty care that we aren't able to provide, we can get you to one of the hospitals in Green Bay if available, or somewhere else if necessary. So I would say we're in good shape right now. From an inpatient perspective, we have changed some of our clinic appointments, physical exams and routine appointments, things like that. We have put off for a week, and also a few elective surgeries. That doesn't mean we're stopping them permanently. That means we're putting it off for a week and we're assessing day by day. The only reason that we're doing that is for staffing purposes. It's not that we don't want you to come into the medical center because of COVID, not at all. If you have a routine medication follow-up appointment, if you're sick and want to be seen, you should absolutely come here and be seen. The only reason that we've cut back some of a few elective things is because we need that extra staff to run the increased hospitalization demand. Now, as I said, there's only 5 patients in the hospital right now with COVID, but we still continue to have the other things that we normally take care of in the hospital, congestive heart failure and pneumonia and any number of different things. Those things still happen even during a pandemic. So I guess that's my way of over-talking the fact that, I'm really confident that we can take care of the community and we'll continue to do so. I guess, Sue, let's talk about Halloween. Is trick or treat going on?
Well, I'm not sure what each municipality is deciding about Halloween, but like everything else in 2020, Halloween should look a little bit different because of COVID. And should you go trick-or-treating? The short answer is not how you have done in the past. So all the things we've been saying, mask, distancing, hand washing, all that applies to Halloween also. So if you do go trick-or-treating, keep those safety measures in mind, and we would recommend that you have no contact trick-or-treating. So in other words, if you want to put out candy for trick-or-treaters, maybe just put it on your step in a bowl, or have some method to get it to the trick-or-treaters without coming close to them. One cute idea I read about was if you have steps going up to your door, use a PVC pipe and put the candy in the pipe and have it end up in the trick-or-treater's bag. That sounded like fun to me.
Mm-hmm.
So please consider other low-risk activities if you're not going to trick-or-treat, just maybe a family party or a virtual party, all those things that we're doing now with COVID.
Mm-hmm. Good, thank you for that. And I guess I also wanted to cover influenza vaccinations, because I think the community has done an amazing job, frankly, of getting out there and trying to get vaccinated. We talked about that at our last Facebook Live, and just today, Sue, your crew was out doing a flu clinic at the county fairgrounds.
Right, it was really cold there.
Yeah.
I said I went over just for a little while, and I said, you guys go sit in the car and warm up.
Yeah.
But Yeah, they had a lot of people come right at the beginning, and I am not sure if we ran out of flu vaccine. We hadn't at 3 o'clock.
Yeah. I know my wife and my son were there right around 3:15 or so, and so that's, yeah. So, and Sue brings up a thing that I wanted to mention, which is, you might have already heard this, but flu vaccine is in short supply. And you sort of think, well, what a surprise. It's 2020. What else is going to go wrong? It seems to be that it's not so much, what did you say before, Sue?
Well, I don't think it's a true shortage.
It's not a shortage.
It's a supply problem right now.
Right.
We just can't get it fast enough.
Yeah, what our lead pharmacist has told me is that, there's 1 million doses of flu vaccination through GlaxoSmithKline, which is one of the drug companies that make them, in some port somewhere in the country, and they're just waiting for the FDA to do a clearance because they came from another country. So it's not a matter of there's not flu vaccine; it's a matter of getting it out to the people. And also, what I mentioned about everyone doing a good job. Typically, in a typical year, we administer anywhere from 4,000 to 5,500 doses at Door County Medical Center, not counting public health, not counting the other pharmacies. Last year, the pharmacy folks order flu vaccination about November of every year. Last year, 8,200 doses were ordered for the year. We're still waiting for 4,100 to arrive. And interestingly, 4,100 doses have been received so far by people. So last year, about this time, we were between 1,600 and 2,000 doses. So you figure last year we were at 2,000, now we're at 4,100. So we've had double the demand, which is a good thing. We're hoping to get more in mid-November, but we're sort of at the mercy, like anything else, even with testing. We're at the mercy of the companies. As of this morning, sounds like Surgeon Bay Pharmacies, Walmart, Walgreens, CVS do have regular vaccine, but not the high-dose vaccine. I heard CVS, though, is running a little short as well. Aurora and Bay Hometown have little to none. And if I'm wrong, I apologize for that. I don't want to steer people away. My intention is only to sort of let you know where you can go to get your vaccine. So the bottom line is it's not an issue with just the hospital or public health or anyone. It's more of a general issue. The supply information will change on a weekly basis. There's no guarantees. So if you can get your flu shot somewhere, get it. So it's great if you want to wait to get it here or get it through public health, but if you can find it at one of the local pharmacies, do that, because it's important that you get the vaccine this year. And I'm really encouraged that so many have already gotten vaccinated.
That's great, yeah, that so many people have gotten protected. It's
Yeah.
very important this year.
One other thing that Amy Conop, our pharmacist, has brought up is that there was a rumor that we don't have a flu vaccine for under 6 years old. That's not true. Let's see, the age range is 6 months to 2 years that we need to have the injection for. So if you're 6 months to 2 years, we use the injection. We're using nasal whenever we can for youth over the age of 2. And retail pharmacists can give vaccinations to 6 years old and up, which is why this came up. I hope that makes sense. Does that make sense to you? You're more up on this? Okay, good. And also the American College of Infection Prevention says that not all vaccines are likely to be uniformly available, so vaccines should not be delayed to obtain a specific product. So if you can get it, in other words, get it. So we wanted to point that out. I guess I don't want to keep doing all the talking, but I'll just mention there's always a lot of questions on testing and how testing is going here. We are advancing our testing capabilities, so our hope is that by the early part of November, we will be able to do 100% of our testing in-house. We have some new instrumentation that's going to be coming on that will allow us to test not just for COVID, but for influenza and for other respiratory illnesses as well. We will, by the end of this week, have antigen testing up and running. Antigen testing we probably are going to be using it mostly for, at least to start, mostly for patients that are symptomatic in our emergency room and for hospital employees that have symptoms. And the reason I say with symptoms is this test is a little different as far as how sensitive and specific it is relative to the other tests that we use, in that it's a good test if you have symptoms. If you don't have symptoms, you can get false positives. There's a little more to it than that, but that's the rough idea. So the hope is through different modalities we'll be able to do all of our testing in-house, and some of these delays that we have seen even this week from tests going to outside laboratories, we're hoping we can prevent that from happening any further. It's not just a Door County problem. This happens all over the place. So, but everyone is working hard to try and get the tests completed, get them resulted in a very timely fashion, usually within 48 hours, ideally, if we can. Anything else you can think of, Sue, that we should cover?
Well, I don't know if everyone caught the news today that a circuit court judge denied the Wisconsin Tavern League's request for a temporary injunction on the emergency order number 3, which limits public gatherings to 25% capacity. So that is back in play. That 25% capacity limit is enforced now again. It's hard to keep up with these things.
It is.
But this is a really important ruling to help us prevent the spread of virus by restoring the limits to public gatherings. So,
yeah, because again, the perfect storm for SARS-CoV-2 virus is indoors with larger groups of people, close contacts, bad ventilation. You get those you get all those things in combined, and the virus will love you for it because it can then spread and propagate, which is all it wants to do. So that's what we're really trying to avoid. And when people like me that do and Sue that do this every day, all day, people say, I'm sick of hearing about this. Trust me when I say you're nowhere near as sick hearing about this than the two of us are, and other people that I work with, because it's slow to go away, and I really do believe that if we did some of these important hygienic measures like the distancing, wearing masks, washing our hands on a more regular basis, we could slow this down significantly and just get to a point where all we're doing is tamping out little brush fires, and that's sort of the goal. So I think with that, we're going to call the video quits. Again, our apologies for not being able to present this live so that you could ask questions. We are going to get another Facebook Live on the books so we can address the questions that you may have. Hopefully that will be, I'm thinking maybe a week from now, if that works on your calendar. So hopefully we'll shoot for next Monday night. And in the meantime, thank you again so much for joining me, Sue. It's always a pleasure. And I wish you all well. Take care.